Dear students, today's topic is infections in animal bite wound. Most of the time, the question is oral question is asked for the students. So at the end of video, the student will be able to enlist the organisms or the bacteria causing the animal bite wound infection. So this is not intended to be some other infection, but wound infection. So other infection, rabies and toxoplasmosis, that is because of the dog bite and cat bite respectively. So that is not intended intention of this presentation. This is for the wound infections caused by the animal bites. Now most of the times it go unreported and it is limited to dog and cat bites. Dog and cat bites are the most common bites which are reported, and it is reflective of the oral flora of the biting animal, and victim's own skin is often acts as a second invader. The skin commensal organisms, they act as a second invaders, and there is a mixed growth, aerobic as well as anaerobic growth. So first we'll go for the dog bite infections. So this is the list of the organisms. If you see, the most common, that is a Pasteurella, 50% among the 50%. So this is the study, the reference is given. Then followed by Streptococcus, 46%, Staphylococcus, 46%, then Neisseria, 32%, Corynebacterium, 12%, then Moraxella and Enterococcus, 10% each, then Bacillus species, 8%. So these are the aerobic organisms. And if you go to the anaerobic organisms, Fusobacterium, Porphyromonas, Prevotella, Propionobacterium, bacteroids, Peptostreptococcus. So these are the organisms which are causing the anaerobic infections in the animal dog bite infections. So this is the reference of this study. In the end, I have given. So students are advised to refer those things which are given in the detail. Now, first mention worthy organism is the Pasteurella, Pasteurella multocida, and Pasteurella canis. These are the species. So, what is Pasteurella? No, it is a non-motile gram-negative Coccobacilli, bipolar appearance, aerobes or facultative anaerobes, and here characteristic feature is hyaluronic acid, which is an important virulence factor. It can grow on blood agar or chocolate agar, and it is a commensal organism in the healthy animals. So Pasteurella multocida and Pasteurella canis, these are the human pathogens. And how is the clinical presentation? Localized cellulitis is there, lymphadenitis, and respiratory disease. Sometimes it may present, or it may present systemic illness in the immunocompromised individuals. The penicillin is a drug of choice, and others are other drugs which are there advised: extended spectrum cephalosporins, macrolides, tetracyclines, fluoroquinolones. These can be used as alternative drugs. Now, there is another organism known as Capnocytophaga canimorus. It is a gram-negative fusiform gliding bacilli which forms a part of normal flora of the dogs. So the presentation: septicemia, peripheral gangrene, endocarditis, meningitis following the dog bites, and immunocompromised individuals more susceptible and producing the systemic manifestations. Here the study says that horse blood agar is useful for the cultivation of Hypnocytophora canimorus. It can't grow on McConkey or it can't grow on TSA also. And another the experimentation was done. Gram stain from the Buffy coat from petechial lesions was taken. It was found to be useful for demonstration of Capnocytophaga canimorus. Then fungal infection, blastomyces dermatitis is also been reported from the dog bite infections. Now come to the cat bite. So Pasteurella, again, the organism, majority of the organism is Pasteurella, followed by Streptococcus, Staphylococcus, Neisseria, Moraxella, Corynebacterium, Enterococcus, and Bacillus. So these are the aerobic organisms which have been reported in the study mentioned below. And then anaerobic organisms are Fusobacterium, Porphyromonas, bacteroids, Prevotella, Propionobacterium. So these are the anaerobic organisms reported in the cat bite wound infections. And there is one disease known as cat scratch disease. So previously it was caused to be The cause was supposed to be unknown. Now it has been found that it results in the because of the scratch of the cat or bite of the cat. So cats, they are the reservoir of the organism. The causative organism is Bartonella henseli. The transmission of the Bartonella henseli to cats, the transmission within the cats, it occurs because of the cat flea, bite of the cat flea. So Tinocephalitis felis, that is the vector of transmission among the cat. And the human beings acquire the disease because of the scratch or bite of the bite by the cat, and it is reported worldwide. Fever and regional lymphadenopathy, these are the common clinical features, and usually in HIV/AIDS individuals, bacillary angiomatosis presentation is there, resembling Kaposi's sarcoma. It is seen. And this organism is a fastidious nature. What do you mean by fastidious? The organism requiring the additional exacting growth requirements. So isolation, it is very difficult. Isolation of the organism is very difficult. Various culture media like rabbit blood and chocolate agar have been tried and found to be useful. Then serological detection can also be done by demonstration of the antibodies by indirect immunofluorescence assay. Indirect immunofluorescence assay is used for demonstration of antibodies. And then molecular techniques such as PCR, it is often utilized for its identification. So cat scratch disease, we should not forget. Now come to the infections because of the monkey bite. The spectrum of isolates from human bitten by monkeys is similar to the isolates of human bite. And as I have told you in the beginning, first is the commensal organisms present in the saliva or in the throat of the animal, and second one is the pre-existing normal flora of the human beings. So alpha hemolytic streptococci are there, causative agent. Then enterococci, Staphylococcus epidermidis, Neisseria, and then Haemophilus species, Echinella corrodans, and anaerobes. In anaerobes, bacteroids and Fusobacterium species. So these are the causative agent in monkeys. Now come to the horses. Infection because of horse bite. Again, it is being very rarely reported. So these are the organisms: Actinobacillus, the Staphylococcus aureus, Neisseria, Streptococcus species, Prevotella melanogenica, E. coli, Passerella multocida, and bacteroid species. So these are the infections, wound infections because of horse bite. Now come to the infection with the rat. So well-known thing is the fever, and it has been told as rat bite fever. Rat bite fever is caused by two organisms, Streptobacillus moniliformis and Spirillum minus. So Streptobacillus moniliformis is a fastidious, highly pleomorphic organism, filamentous and gram-negative bacilli. Spirillum minus is a short, slightly curved, gram-negative rod, that is a Streptobacillus moniliformis. And it is more, the Streptobacillus moniliformis is the that more common in North America, whereas Spirillum minus is more common in Asia. So that is a fever, rat bite fever. Wound isolates Staphylococcus epidermidis, Bacillus subtilis, alpha hemolytic streptococci, and then diphtheroids, Actinobacillus. These are the other isolates in the wound. But if it is systemic illness, the rat bite fever. Snake bite infections, wound infections, cons, coagulase negative staphylococci, Proteus species, Morganella morgani, Aeromonas hydrophila, Enterococcus faecalis, Clostridium species, Pseudomonas aeruginosa, Proteus species, and Bacteroides praesalis. So these are the references. So these two references are very nice, and the PG students actually they should refer these. I suggest them to refer this. And this question can be asked in orals, they may ask, or Sometimes it may ask as a question. I have not seen as a question, but oral they may ask in the organism, especially dog bite. They will ask wound infection caused by dog bite. So you should not forget Pasteurella multocida. Then I forgot one more thing, that Staphylococcus intermedius is also there. Then in cat bite, cat scratch disease, that we should not forget. Other organisms are there. So this is about the wound infections because of annual bite. So thank you for your patient listening. Thank you.